Can I ask David to come up here? Does David still? Yeah. Why don't you have a seat there? We have time just for a few questions. We're running a little bit late, although we'll adjust the time accordingly. But I wanted to give people a chance to ask any questions you have of our last two morning speakers, and you can use the microphones on either side. While you're thinking about that, I just want to ask Anita one thing. Anita, where can people get the data that the NCI is putting out that you mentioned in the various reports? Where can they acquire those that information?
The reports come back to us December. Is this microphone on? From the working group by December 15th. Our plan is to draft it into a manuscript form, which will take over several months or so. But our hope is to actually post the working group, particularly their slides, on a website. It'll either be the NCI website or CTEP website or the Division of Cancer Population. So the actual working group reports will not be available for several months, but the slides hopefully will be available in the next few months.
I think also the links to both the NCI and I think the Institute of Medicine sites are on our website as well, yes, for any of you who want to find that. Any questions from our group? I know we're running a little bit late, but I want to make sure that we haven't missed anything. Go, Archie, use the mic, yeah. Thanks. Hopefully it's working.
This applies to our country and more perhaps than other places. The observation that the older the child or the person with ALL or AML is, the more likely they are not going to survive. You've seen that in a variety of tumors, but especially knowing that ALL and AML both have been shown to be correlated with the body mass index, meaning the more overweight per size, per height, the greater the obesity or overweight, the more likely you're not going to survive ALL or AML. That's been reported by Bev Lang, and it's being studied at Children's Hospital Los Angeles in exquisite detail. It makes me think that our obesity problem could be part of the answer to the COG studies, and then the comparison with Eli Esty of the AML studies in adults is why that difference may have occurred, because the obesity problem is greater in adolescents than it is in children, and it's even greater in young adults than it is in adolescents. That's available, height and weight on all those patients. Have you looked at BMI, David, in either ALL or AML to explain that worse survival?
Well, I think it's a topic that's beginning to be explored in more detail. In terms of the COG analyses that I reported here, to my knowledge, it wasn't controlled for in those analyses. There was one disease group, I believe it was the AML population, where obesity was more common. It was in the intra-COG analysis of AML. As you said, obesity was more prevalent among the older patients than it was in the younger patients. And I don't recall right now whether Todd Alonso's analysis, showed, maybe it wasn't reported in the manuscript because it wasn't significant. I don't recall right now. But it hasn't been looked at in depth. One of my colleagues at Children's Hospital Los Angeles, and in fact, Nita and I have been working on this together as well. She led the high-risk ALL study in the Children's Cancer Group. We've been doing a secondary analysis with a young investigator here at CHLA to explore the role of BMI changes on treatment, both higher and lower, and those results are being finalized for publication.
Yeah, Dr. Budarini here at CHLA has been looking at the animal models of this. The reason I bring this up because increasingly the individual drugs we're using, when we sort of parse out the effect of, let's say, asparaginase, and that really stands out right now, is that the more overweight the person is, the more likely they're risking grade 4 and 5, including death, toxicities from that agent alone. So and when you think about vincristine, a randomized trial was done in COG to increase the dose of vincristine above the cap, which is a 2 milligram total dose when you get to be about 1 square meter, versus not capping it. And it was the adolescents that had that same problem. We had to stop that study early because the adolescents couldn't tolerate the neuropathy that created. So there may be some pharmacokinetic reasons for BMI influencing some of these outcomes.
I think it's an area that's wide open for research. I don't know if Nita wants to add anything to that, but I think there's clearly a need for more research in that area. The whole developmental pharmacogenomics, and then how that interacts with other factors like obesity are really a big black box at the moment.
I don't see anybody else at the microphone, but those were 2 superb presentations. What a marvelous review, years and years of work and conclusions. Superb. Your workshop was very successful. And David, can you tell us a little more about the amenity, the spirit of this first ever collaborative group meeting between the 4 cooperative groups? How many showed up from all 4 groups? Give us an idea of the number.
Well, we had representatives from all of the new consolidated NCI-funded cooperative groups, except for energy. They weren't able to, it was a short timeline on this, and they're fully on board in terms of moving forward, but they weren't able to get an investigator to that. But the representation was excellent, and I think the big challenge now, and I do want to acknowledge Brandon's, role in co-leading that workshop. The 2 of us are eager to move forward with it, but I think we all feel the pressure now of needing to perform. We've talked about it and we've identified a roadmap, but we need full engagement from the cooperative groups, which I think we have. Our partners at NCI couldn't be more supportive, and I think that's just one of the most exciting things about AYA. I admit to being wired as an optimist. I tend to see the possibilities rather than the barriers, but I think even allowing for that, I really think we're on the cusp of an age of transformation of AYA oncology, and a lot of it is because of the help of people in various quadrants. And I think that as far as clinical trials themselves go and the cooperative groups, I think NITA's leadership at NCI shouldn't be underemphasized. It can't be underemphasized. It's really been important for moving this forward.
Okay, I'm going to sort of call this part of the program to an end because I know we're running a little bit late. 2 things I want to make sure before you go to lunch. One is we're going to come back at 1:40. We're going to start just a little bit later so that we can give you a chance to look at the posters and talk to our students and investigators out there who are involved in those posters. I think you'll find it very interesting, some very interesting data. And then I want to really encourage all of you to stay for the rest of the afternoon when we've got, we're going to hear some really remarkable stuff from the Strouds and their journey with their son David, and then hear from Larry Neinstein, James Hu, and Heidi Adams, again in leadership positions in the various areas they're going to talk about. I think you're going to find that hearing about the patient perspective, hearing about the issue of AYA cancer in the military and in student populations, which are the 2 largest organized populations of AYA patients in the AYAs in the country, is going to be very revealing. So.